I'm Dominic Raj, a professor and chief of the Division of Kidney Diseases and Hypertension at the George Washington University School of Medicine. I'm the co-chair of the Global Nephrology Summit, along with my esteemed colleague, Mr. Paul Conway, the chair of Policy and Global Affairs and immediate past president of the American Association of Kidney Patients. We welcome you all to the third Global Nephrology Summit, which unfolds on the heels of the overwhelming success of the two previous summits and the promising new pivotal international partnerships. The central theme of this event is science, innovation, patient choices, and international voice. Paul Conway comes with these wonderful, meaningful, rhyming themes that never cease to amaze me. Let me begin by expressing my overwhelming gratitude to the attendees, our Dean, Barbara Bass, and AAKP leaders Diane Kleins, Richard Knight, and Paul Conway, and several others who worked tirelessly behind the screen. The American Association of Kidney Patients and the George Washington University School of Medicine came together in 2019 to organize the first Global Nephrology Summit. AAKP was started in 1969 by 6 dialysis patients at Kings County Hospital in Brooklyn, New York. It is now grown into an internationally recognized patient organization that reaches over millions of people under the leadership of Richard Knight and Paul Conway. AAKP is committed to improving quality of life for patients through education, advocacy, and patient engagement. The George Washington University School of Medicine was founded in 1824. The GW School is the first in the nation's capital and 11th in the nation. The first life-saving dialysis was performed in GW Hospital in 1956, only 2 years after it was introduced in the US. First kidney transplantation was performed in 1976 at GW, and a new robust transplant program re-established in 2014 during my tenure to serve the DC community. Our commitment to care of people with kidney disease continues unabated till today, with the US News and World Report ranked nephrology division. The central theme of the 2020 Second Global Nephrology Summit was expanding patient choices and outcomes. It was a tremendous success by all measures, in which more than 20 speakers shared their expertise through 40 presentations. It was watched by more than 20,000 people from 70 countries, which enabled us to expand our reach and forge new partnerships across the world. Why do we need a Global Nephrology Summit? In 2017, the global prevalence of CKD was 9.1%, which is roughly 700 million cases. Since 1990, the prevalence of CKD has increased by 29.3%. The global mortality rate for CKD is not declining, unlike those for other important non-communicable diseases, thus emphasizing that a sustainable and affordable healthcare infrastructure for CKD is a global priority. The burden of CKD is disproportionately higher among developing countries and among individuals in the lower socio-demographic index. It is important to note that CKD is preventable and treatable disease that deserves greater attention in global health policy, particularly in low and middle income countries. The second Global Kidney Atlas project surveyed 182 countries to determine the global capacity to provide dialysis and transplantation. The study showed that many participating countries provided public health funding for kidney replacement therapy, but many low-income countries are incapable of providing public health funding. There are fewer nephrologists in low-income countries. The concentration of nephrologists in high-income countries is 60 times higher than that in the low-income countries. Needless to say, all these greatly reduces access to care in countries with fewer resources. Nephrology has come a long way since the initial description of kidney disease by Richard Bright. A late bloomer, we are now talking about multi-omics, systems biology, precision kidney medicine, and gene editing to reverse fibrosis of the kidney. Discoveries have been made in oxygen sensing, which earned the 2019 Nobel Prize in Medicine, and we are one step close to growing made-to-order kidneys in labs. Amazing discoveries in laboratories have led to novel therapies for anemia through HIF modulation, slowing progression of diabetic kidney disease through SGLT2 inhibition, safe treatments for hyperkalemia, therapies for glomerular diseases, and targeting inflammation to reduce cardiovascular mortality in CKD. Closer attention is being paid to the role of race in estimating kidney function and determining clinical outcomes. After decades of inaction, the US government committed to create a system that pays for kidney health rather than for kidney sickness. Most importantly, CMS proposed a payment model that increases treatment choices and incentivizes home-based dialysis and kidney transplantation. Partnering with patients, we are moving forward with big goals and clear objectives in 2020. We are striving to empower patients and bring the desired discoveries to our patients, thus heralding a new era of kidney health. Through this conference that transcends borders, we will be hearing from organizations across the continent forged by desire to end status quo in discovery and patient care. Talking about international collaborations, we saw the world community coming together in combating COVID-19. Faced with the lack of understanding about the clinical spectrum of COVID-19 infection and unsure about how to treat the disease, we fervently reached across the globe, driven by the desire to learn and to do what is best for our patients. Indeed, during the past 2 years, we have witnessed unfathomable patient morbidity and mortality, and also rapidly learned many lessons on emergency preparedness, supply chain management, professional improvisation, and technical and healthcare delivery innovations. Sir William Osler said, "The good physician treats the disease. The great physician treats the patient who has the disease." The time is now to engage our patients, energize them, and continue to develop partnerships across the world with unified mission of promoting highest quality of patient-directed care and to advocate for more investment in kidney research. I believe I have introduced to you the theme of the third Global Nephrology Summit, that is, science, innovation, patient choice, and international voice. Now sit back in your most comfortable chair and enjoy as the true experts speak and patient voices ring. Give us feedback, tell a friend, and share the invitation. Thank you very much.